The TriClip endoscopic clipping device is used for endoscopic clip placement within the gastrointestinal tract for the purpose of endoscopic marking, hemostasis for mucosal and submucosal defects less than 3 centimeters in the upper GI tract, bleeding ulcers, arteries less than 2 millimeters, and polyps less than 1.5 centimeters in diameter in the GI tract. This device is not intended for the repair of GI tract luminal perforations and is supplied sterile and intended for single use only. Do not use this device for any purpose other than the stated intended use. Inventory rotation of sterile products is essential. Verify the expiration date on the package label prior to using the product. If the expiration date has lapsed, do not use or re-sterilize this device. If the product package is open or damaged when received, do not use this device. Wilson Cook devices must be stored in a dry location, away from temperature extremes. The number of clips required for hemostasis may vary depending on the anatomical site, histology, lesion type, and patient condition and history. A sufficient quantity of clips should be prepared in consideration of all these factors prior to the procedure. Contraindications include those specific to the primary endoscopic procedure to be performed in gaining access to the desired site. Contraindications to endoscopic hemostasis include, but are not limited to, uncooperative patient, coagulopathy, cricopharyngeal or esophageal narrowing or stricture, and tortuous esophagus. Potential complications associated with gastrointestinal endoscopy and endoscopic hemostasis include, but are not limited to, perforation, hemorrhage, aspiration, fever, infection, allergic reaction to medication, hypotension, respiratory depression or arrest, cardiac arrhythmia or arrest, hematemesis, transient dysphagia, aspiration pneumonia, wound dehiscence, minimal acute inflammatory tissue reaction, transitory local irritation, migration of the clip into the bile duct, and anatomy disruption. The coordination of the accessory channel size with compatible devices is essential in obtaining optimal results during a procedure. We recommend a minimum 3.2 mm endoscope accessory channel when using the 8 French sheath, and a minimum 2.8 mm accessory channel when using the 7 French sheath. Refer to the product package label for the minimum channel size required for this device. The endoscope must remain as straight as possible when inserting or withdrawing the device. A thorough understanding of the technical principles, clinical applications, and risks associated with gastrointestinal endoscopy and endoscopic hemostasis is necessary before using this device. This device should only be used by or under the supervision of physicians who are thoroughly trained in therapeutic endoscopy and endoscopic hemostasis. Endoscopic hemostasis should be performed under direct endoscopic visualization. Clipping hard or severely fibrotic lesions to achieve hemostasis may be more difficult. Lesions located in the esophagus and the lesser curvature of the stomach may be difficult to treat with a forward-viewing endoscope. Treatment of esophageal varices may require clipping in combination with a sclerosing agent. The use of clips in the presence of bacterial contamination may potentiate or prolong infection. Failure to deploy a clip or improper deployment of a clip may require surgical intervention. Wire cutters may be used to cut the wire and sheath. Electrosurgical devices used after clipping may cause patient injury. MRI compatibility of the TriClip endoscopic clips has not been established.